This is the injury report presented by NYU Langone Health.
Mets catcher Francisco Alvarez has hit the IL after sustaining a UCL sprain in his right thumb, which is a blow for a team currently clinging to a wild card spot. So let's bring in Dr. Borowski from the NYU Langone Sports Medicine Center to help us break this down. Doctor, thanks so much for joining us. So talk to me, what is a UCL sprain and how does that develop? How does that happen?
So there are ligaments around all of our fingers, all of our joints. And in the UCL is one in the thumb, which is kind of like in the middle here, that we call that UCL. And there's a lot of different ways you can injure it. The most common ways that I see it in my practice are actually from skiing or other injuries where the thumb is wrapped around something and kind of gets pushed back. And so it's called skier's thumb for that reason, or other times we call it gamekeeper's thumb. So with a repetitive injury or when you're trying to catch something, you can imagine that if the ball hits his thumb in the right way, or I should say the wrong way, really, you can end up pulling on that ligament and spraining, stretching that ligament on the inside of the thumb.
Yeah, that sounds so painful. So being a catcher, the use of his hands is really important for Alvarez. So is this an injury you can play through relatively safely?
It would be tricky because he's constantly catching with that hand, right? And so it's repeatedly injuring it again and again. So you can get an initial trauma where there's something very specific that happens, or it could happen over time with repetitive kind of micro traumas, repetitive constant pushing of that thumb. So it would be very painful to be playing through it if it wasn't if he's constantly catching with that hand.
Yeah, of course. And the Mets have said that he will likely get surgery at some point. So what would that surgery do? And will delaying the surgery make that injury worse?
Reasons why we end up getting surgery for it. Sometimes if there's a complete rupture of the ligament, also sometimes the ligament doesn't heal down quite right. It doesn't scar down in quite the right place because there's some other tissue in the way. And so playing through it is again going to cause prolonged pain. It's probably, if he's planning on having surgery already, it's probably not going to change a whole lot of what they might do. But either way, he's going to be in a cast splint for at least several weeks after a surgery.
So you mentioned several weeks. Would you say that's how long it takes to recover from that kind of surgery?
So if you're not having surgery, the treatment that we usually do is immobilize in a splint for 6 weeks anyway. And so sometimes going to surgery might speed up the timeline a little bit, because let's say he gets to the end of that 4 to 6 weeks in that splint and he's still having pain, they might then decide to go to surgery. So then he's wasted, another month. So sometimes that's one of the reasons why they might jump to surgery sooner. But yes, I mean, it's still after the surgery, after they've repaired it or reconstructed it, they will have him immobilized for that, at least 4 weeks or so, typically.
All right, makes sense. I know the Mets want to get him back as soon as possible, but got to let that recover. So do non-professional athletes suffer from this injury, from UCL sprains, and would their course of treatment be the same?
I was mentioning that the other ways that we see it are often when somebody's holding something in their hand and they kind of fall and the thumb kind of gets pressed open. So skier's thumb, gamekeeper's thumb can happen to a lot of non-athletes, and that's probably who I actually see it in more commonly. And the treatment is really that immobilization for probably, at least 4 to 6 weeks to see if we can get that ligament to kind of scar down in the right place.
All right, well, again, the Mets are hoping this moves along quickly. They need him back in the lineup. Dr. Borowski, thanks so much for joining us today.
Thanks for having me.